I'm Joseph Brodescabot, interventional cardiologist from the Quebec Heart and Lung Institute in Canada. And today I'm going to talk about the LITEN trial that was presented in a late-breaking trial session here at the EuroPCR. Yes, in fact, the study focused on patients with surgical failed bioprosthesis in aortic position. And in this field, all the data that we have collected have been of retrospective nature. Among these data, there were data suggesting that some types of transcatheter valves, like those with supra-annular valve position and sometimes with larger valves, were associated with better hemodynamic outcomes. But there was no randomized trial in the field up to now. The patients included in the trial were patients with small stented surgical valves that failed, either because of stenosis or regurgitation, meaning that all surgical valves were less or equal than 23 millimeters. And these were the patients that were selected for the trial. And these patients were, before the TAVI procedure, were randomized to receive either a balloon expandable valve, SAPIEN 3 or SAPIEN 3 Ultra, or a self-expanding valve system, Evolut Air Pro or Pro Plus. Well, I think it's already well known. The balloon expandable Edwards valve is a balloon expandable valve. Maybe the differences are, as I said, two. First, in general, when sizing these valves with respect to the surgical valve, in general, the Evolut system will recommend larger valves for a specific surgical valve size. And the other important differential aspect is that the SAPIEN valve is the valve that is located at the annular level, whereas the Evolut valve, the valve leaflets are located supraannular. And these could potentially be associated with some advantages in terms of valve hemodynamics. Yes, the primary endpoint of the study was the echo findings, and the valve hemodynamics is as evaluated by echo at 30 days. And all these echo findings were evaluated and measured in a central echocardiographic core lab at our institution. The main findings showed that the Evolut valves were associated with lower transvalvular gradients, maximal, mean. Lower percentage of patients ended with mean gradients above 20 millimeters of mercury. And in terms of another co-primary endpoint, which was severe prosthesis-patient mismatch, there was a tendency towards a lower rate of severe PPM among Evolut patients compared to the SAPIEN counterparts. These are the primary endpoint findings. In terms of, there were two important also secondary endpoints, the clinical data at 30 days, which were very good for the two valve types. No deaths, no strokes, no pacemaker, zero. Some vascular complications, but really no major events leading to patients' death. And also we performed a sub-study, an invasive sub-study, measuring valve hemodynamics invasively during the procedure, during the second period of the study, including about half of the patients of the total number, which was 102. About half had this invasive study. And in the invasive study, we realized also that, at least during the TAVI procedure, the measurements you have in terms of valve hemodynamics, the mean gradient, for example, was much lower compared to echo. And this was true for the two valves, but maybe these differences were more important in the SAPIEN group. And this translated into the lack of significant differences between groups when we evaluated valve hemodynamics invasively. Again, was a smaller number of patients, was a secondary endpoint, but I think that is also was also an aspect that should be highlighted. I think that the first take-home message is that, as it was already suggested in retrospective studies, this randomized trial confirmed that the self-expanding Evolut platform provided improved valve hemodynamics as evaluated by echo compared to the SAPIEN valves. I think that this was the primary endpoint, and this is the first take-home message. The second message could be also that the results, at least at 30 days, were excellent for both valve types, and this is also important to highlight. And then the aspect of invasive hemodynamics versus echo, that I think opens the door probably for future studies in the field. I think that the next steps would be mainly to follow these patients and to see what is the clinical follow-up, what is the potential impact that these hemodynamic differences can have at mid to long-term follow-up in terms of clinical events, and probably thinking about really to have a comparison powered for clinical events in this group of patients. I think that this is something that probably will be needed in the future, not only for these two valve types, but for other valve types that are in the market, to see what's the performance of each different valve in this group of patients that remain challenging, these patients with surgical valve failure, with the small surgical valves. And also the second thing also is probably to see really what does it mean, these differences between echo and invasive hemodynamics, whether or not this translates into differences in clinical events based on one type of measurement versus the other. I think that nowadays we really don't know.